Back now with today's health alert. March is Colorectal Cancer Awareness Month. While overall rates are dropping, colorectal cancer remains the third most common cancer diagnosed in both men and women. It's also the second leading cause of cancer-related deaths overall. Our chief health editor, Dr. Partha Nandi, joins us now. Dr. Nandi, so glad to have you here. Rates are going down, but we're seeing more cases in younger people. Why is that?
Yeah, it's really worrisome. I see it firsthand in my practice. More young people are being diagnosed with colorectal cancer, and it starts in the colon or the rectum. In 2019, in fact, 1 in 5 cases were in people 54 or younger, compared to just 1 in 10 back in 1995. And advanced colon cancer cases have been rising by 3% per year in people under 50. Meanwhile, deaths in this group have also been increasing by about 1% each year. So all bad news. So why is this happening, right? We just really don't quite know for sure. However, according to the American Cancer Society, more than half of all colon cancer is attributable to lifestyle factors, things like an unhealthy diet, lack of exercise, drinking too much alcohol, and smoking. Another big risk factor, Whitney, is that colon cancer can also be increased with family history. So if you have a parent, brother or sister, or child that has been diagnosed, your risk jumps 2 to 4 times higher than someone without that family history. So that being said, right, experts haven't been able to fully link the genetics to the rise in younger adults.
Now, when should people be concerned about symptoms and when should they be getting screened?
So first of all, lots of people have no symptoms. Please remember that you may not have any symptoms, but I always tell my patients, please pay attention to your body. If you have any changes in the way your bowels move, if you have blood in the stool, unexplained weight loss, abdominal pain, fatigue, even if you think, hey, it's just hemorrhoids, please don't blow it off. Go see your doctor. And here's why. Screening saves lives. Point blank, colorectal cancer is treatable, especially when caught early. A colonoscopy is the gold standard for testing. And, there are also stool tests that can help with early detection. Lots of my patients say, this is exit only, doc. I'm not going in. Please, you got to do it, because if you don't, you could lose your life to this disease. As for when to get screened, guidelines now recommend getting started at age 45. But hey, if you're in your 20s, 30s, or 40s, early 40s, and you have any unusual symptoms, please don't wait. Get checked. I had an NHL executive who thought it was hemorrhoids, blood and stool. By the time he was screened, he had stage 4 cancer. Please don't let that happen to you. Many cases and deaths can be prevented with regular screening, follow-up care, and effective treatment. And you can also lower your risk by eating a high fiber diet, right? Not those burgers and your processed foods. Avoid eating excessive red and processed meals. Stay active, watch your weight, limit alcohol, and please don't smoke. Colorectal cancer risk does increase with age, but it can also affect younger adults. But I think, listen, you can prevent it. We can stop this killer by being screened.
Like you said, screening saves lives. So thank you so much,
100%.
Dr. Nandi. Great advice there. And if you have a question for the doctor, you can email him, Dr. Nandi, at ask@drnandi.com or send it to us on Facebook.